Joining us now, Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases. Dr. Fauci, good morning to you, sir.
Good morning.
Let's start with that mutated strain, first found in Colorado, now apparently in Southern California. A lot of folks concerned about this mutated strain, Dr. Fauci. How worried should we be, and should we assume at this point that mutated strain is likely already widespread in this country?
Well, it's here, no doubt. I mean, we predicted it would be when you have so much of it in the UK, which then spread to other countries in Europe and Canada. It was inevitable that it would be here. So you're going to be hearing about reports from other states and more cases in the states that have already reported. And unfortunately, that's just the reality of the way these viruses spread. Obviously, you have to take it very seriously. Our British colleagues have shown clearly that it is much more efficient in spreading from person to person. The good news is that it does not appear to be more virulent, namely making people more sick and leading to more deaths. So that is a good thing. I mean, obviously, we don't want to see a virus that has a greater capability of spreading. The other thing that is important and a favorable thing, it does not seem to evade the protection that's afforded by vaccines that are currently being used. But the fact that you have a virus that spreads more efficiently is something that's important and needs to be taken seriously. This just underscores the need to continue to put our foot to the floor and the pedal about making sure we do the public health measures that we talk about all the time, the wearing of masks, the physical distancing, the avoiding crowds in congregate settings. Those are the kind of things that will prevent this new strain from spreading even further.
Dr. Fauci, let's talk about vaccinations for a moment and the rollout here in this country. And I want to put these numbers on the screen for our viewers at home so they can see these numbers. According to the CDC, just over 14 million vaccines have been distributed to the states. People vaccinated, about 2.8 million. The goal, as you know, for the end of the month was 20 million vaccinated. For months, we've known these vaccines were coming. What happened, Dr. Fauci?
Well, whenever you have a massive program such as this, I mean, this is the largest and most important vaccine program that we've ever undertaken. I mean, we'd have liked to have seen it run smoothly and have 20 million doses into people today by the end of the 2020, which was the projection. Obviously, it didn't happen, and that's disappointing. Hopefully, as you get into the first couple of weeks in January, the gaining of momentum will get us to the point where we want to be. But there really has to be a lot more effort in the sense of resources for the locals, namely the states, the cities, the counties, the places where the vaccine is actually going into the arms of individuals. We have to support the local groups, the states and the cities, to help them to get this task done, which is a very prodigious task.
Dr. Fauci, to that point, though, that this idea that the states, cash-strapped states in many cases, cash-strapped public health departments, especially in many states, this is obviously a threat to our national security. Would it be better if the federal government just stepped in and took over the effort to get millions of Americans vaccinated?
Well, rather than stepping in and taking over, I think it would be maybe better to give more resources and to work with them, in tandem with them. In other words, it's not saying we're taking over, we're going to do your job, but saying we're going to really help you to do your job, particularly by giving you many more resources.
Well, I have you. I want to ask you about this approach that's being taken in other parts of the world. For instance, in the United Kingdom, in some provinces in Canada, as you know, after the first dose, they're letting people walk around, and apparently, reportedly, that provides perhaps up to 40% protection against infection, unlike what we're doing, reserving both doses for millions of Americans. Should we change our approach, perhaps?
Well, I mean, that's under consideration. I still think if done properly, you can do a single dose, reserve doses for the second dose, and still get the job done. But there's a lot of discussion about whether or not you want to spread out the initial vaccination by getting more people vaccinated on the first round. And you could debate either way on that. One of the problems of doing that is if you don't then get the second dose in time, you're going to have a lag period. And we know from the clinical trial that the optimal time is to give it on one day, and then for Moderna 28 days later, and for Pfizer 21 days later. That's what the data tells us is the best way to do it. So if you want to stick with the data, that's the way you should do it. But you can make an argument, and some people are, about stretching out the doses by giving a single dose across the board and hoping you're going to get the second dose in time to give to individuals.
Dr. Fauci, last question. Here we are on the last day of a year that no one could have imagined. Years from now, when historians write about this particular chapter in America's story, what do you hope they write?
Well, you know, it's been a very, very tough year. This is the worst that we've had literally in 102 years. So when historians write about this, they're going to write about things similar to what happened in 1918. I mean, from a public health standpoint, we really got into some significant pain and suffering and death. The good news is that science has and will come to the rescue by getting us vaccines, more than one vaccine, hopefully 5, 6, 7 or more vaccines throughout the world that will get us out of this and put this in the rearview mirror behind us. So hopefully, as we look forward to 2021, as we get well into the year, with a combination of vaccines and proper adherence to public health measures, we can end this thing and crush it the same way we have done to other outbreaks like polio and measles and other important infectious diseases. So that's the aim, and hopefully we'll accomplish it.
From your lips to God's ears. Dr. Anthony Fauci, Happy New Year to you, sir. Thank you for your service this year. Do appreciate you.
Thank you. Thank you for having me.